think it's pretty safe to say that I will not experience childbirth. Heck, I don't even know if I want children in general. Although there must be something about my online usage that has made Google and Facebook think I'm looking for a great IVF clinic or adoption agency. Maybe they know something I don't. I can, however, provide some numbers, and who doesn't love numbers, relating to childbirth and maternal deaths, or maternal mortality. I'm pulling these from Matriarch's Data Lookbook, a reference guide of over 25 public health indicators, which you can find on our website. Oklahoma clocks in at 38th out of 50 for maternal mortality rates, which is per 100,000 live births. Births to Black and Indigenous women are disproportionately higher than other communities. So, just for context here, that was a lot of numbers and maybe something that not everyone can understand, but again, for context, the U.S. is ranked 55th in the world for maternal mortality, the lowest of nations similar to its wealth. Oklahoma is in the bottom quarter of the country, who is disproportionately low. Things aren't going so well here. You know what's been shown to help pregnant women have healthier births? Doulas. And what's a doula? Great question. There's a chance that you're like me. You've learned the term, you understand they help people giving birth, and you may have heard the news about SoonerCare coverage. Well, I can't explain it anymore. Let's just get to the interview. Here's Omare Jimmerson from Tulsa Birth Equity Initiative, or TBEI, who serves a lesson on the benefits of doulas and doulas that reflect a person's community. Here we go. And on to the interview. I'm here with Omare Jimmerson, who is the Executive Director at Tulsa Birth Equity Initiative. Hello, Omare.
Hello.
Can you introduce yourself and give a little bit about what you do?
So, Omare Jimmerson, Executive Director of the Tulsa Birth Equity Initiative, also a mom of two, very involved in my community, believe in education, and of course, women. And women having the power to do what they want to do when they want to do it.
Yes, of course. That's the point of Matriarch as well. Sometimes it's a tough job in Oklahoma.
Of course.
You are with Tulsa Birth Equity Initiative, or TBEI, because that's a mouthful. Can you give a little overview of what TBEI does and kind of the amazing things that you kind of do for the community?
Yeah. So at TBEI, we equip women to have healthy births with dignity while also working on the health disparities that exist in maternal care here in Tulsa. One of our main ways of doing that, our flagship program, is our community doula work. We offer no-cost doula services to those who are at highest risk of experiencing a disparity, I should say. And we define that in a number of different ways. But we also work with hospital systems to try to work with those populations in a better manner.
And listeners, we will be getting to that later, because there's a lot of questions in that one little sentence. But first, let's go a little bit about you. So you haven't always been in maternal health care. What were you doing before, and what led you to TBEI?
So interesting. So I have been on the teen pregnancy prevention side for many, many years. I started a program called Strong Tomorrows, which serves expecting and parenting teens, and then stepped away for a little bit and went to become this deputy director for City of Tulsa Parks, which was very different from a lot of things that I've done. But I grew up working in the park system, so it was kind of going back to the original origin of everything. So under Strong Tomorrows, as a person, I always wanted a doula, but was never afforded the opportunity to have one, and came across an opportunity to learn more about the community-based doula program. And so started up the training of the community-based doulas under Strong Tomorrows. But at the time, Strong Tomorrows was in a school district, so it really didn't make sense for the program to live there. The founder of TBEI, I'd known since she was in high school, and at the time she was in the Peace Corps, so begged her to come back, and she birthed TBEI and made it what it is. And so when she wanted to step away, it kind of came full circle, and here I am.
I honestly did not know that I didn't know TBEI started at Strong Tomorrows, and I didn't know that it had come full circle for you. You mentioned the Parks Department, and naturally I've met you. I knew you did that. It was a loaded question. And you did mention that maternal health and parks aren't necessarily the same topic here. Moving from parks back to maternal health, what was the most interesting, funniest transition thing that you had to you were confronted with?
I'll tell you something funny that not really has anything to do with that. But when we talk about like the full circle of everything, when I was in college, I enrolled in 2 women's study classes and like went for 2 days and was like, these people are different. This is not my cup of tea. And I have almost spent 30 years of my life doing something for women in some form or fashion. And so even though the funny thing is I went to work in parks because of the parks director, and her and I had worked in a previous role. She was actually my boss when I started Strong Tomorrows. And so even though we were working in a program that technically wasn't women's health, it was a dropout prevention program, I found a way to tie it back in, and I was starting to do the same thing in parks. So there are a lot of like health classes that exist now that target Black women because I was there. So
that's great. And I'm with you on the college thing. I did a couple like those gender, ethnic, multicultural studies classes and kind of just took them because they were easy A's. And in my master's, there was a public health class offered. I'm like, I don't want to do that. So technically I'm trained to be a city manager, which is totally not what I'm doing now. There's a lot of commonality there. So getting into the more meat of kind of like the TBEI and doula programs. Before I started at Matriarch, I had actually not heard of a doula. I think I maybe had heard the term here and there, but it was definitely something I quickly learned because of the work Matriarch does and how closely we work with TBEI. So for someone like me, when I started, how would you explain what a doula does and like what is the benefit?
So a lot of times people mistake doulas for midwives. And so there's a very clean difference there. A doula is not a healthcare professional. They are there trained to help the woman go through the timeline of pregnancy and labor. They're their support system. And I think one of the important aspects of community-based doula is they work with them to train or to advocate for the patient to be their biggest advocate. So having a voice in a room, if they question something that the doctor has told them, letting them know that no one knows their body better than them. Whereas a midwife is a medical trained profession, and they're the ones that catch the baby, which oftentimes people mistake doulas as that.
Yes, that was one of the ones that someone had to like explain to me, because while we are also talking about and advocating for like doula access, we've also talked about and advocated for midwife access. Yes. And I think I had to have someone just sit me down and be like, this is the difference. Like, oh, yes, thank you. I might have asked one of the graduates from the TBEI program for questions to ask you. So the one that I kind of grabbed was if you could discuss what enabling self-advocacy looks like in action.
If you're at a birth and something just doesn't feel right? So a lot of times people will, like, the family member may look to the doula and it's like, are you going to say something? And of course, the doula is turning it back on the client. And like, remember what we talked about in your birth plan. And because when you're a woman and you're in labor, it's just like at that moment, you just want this baby out of you, right? So like all the pain, all the things that we've talked about, I'm not thinking about right now, but the doula will remind them like, remember you talked about you wanted it this way. And it's okay. And if you change your mind, right? But just reminding them like, it's okay to like push back and advocate for what you said you wanted. We have a lot of women who, walk into a room and say that they want to try to have it unmedicated. And if you want to start there, that's fine. But guess what? You're still a shero if you decide you want that medication at some point.
Oh my gosh. Have you seen the movie Waitress? In one of the moments, she gets into the hospital. She's like, I want drugs. I want every drug you have.
Well, it's my personal experience. I think it was my first pregnancy to try without. And I mean, right or wrong, people may view this differently, but the lady who was, doing all my pre-check-in, she was like, why don't we just go ahead and sign the paperwork? Because, honey, you don't get a medal. And I thought about that and I'm like, yeah, you're right. This is just something in my mind I've just made as a thing that we need to check off. And some people don't like that she said that to me, and other people, I'm just, hey, it's your own decision.
Yeah. And it worked for you in the moment. Mm-hmm. So I know that there are also various doula specialties out there. And maybe you can help people understand what a doula is by kind of maybe saying what a birthing doula is, or a, prenatal doula is, those kind of the specialties.
So a prenatal and a birthing doula are pretty much one and the same, but there are like doulas who only focus on women who have experienced an abortion. And then there are what means not the greatest name to refer to them, but then there are death doulas who work with people that are experiencing loss and grief. And there may be times when those doulas overlap each other, right? So we've had clients in the past who have experienced loss. And so I already have a relationship with my birthing doula, but now I need someone to come in and help. In those terms, it kind of swings into like the therapy side of it too, but everybody has their specialty. Birthing doulas will bring more to the table when it comes to comfort measures around having the birth. They may know a little bit more about lactation and latching. You may find more doulas. We have a couple on our staff that are CLC.
Can you explain what that is?
Oh, sorry. So they're certified as lactation consultants. So they're the ones that can help a woman with latching and all those things, just like the woman that comes in the hospital and helps talk to you about feeding your baby if you choose to breastfeed.
Well, that's cool. I know that we've talked a lot about baby-friendly hospitals and exclusive breastfeeding. When I say we, I mean, I'm pretty sure I've written most of those. People like to just, whenever I tell people what I do, they're like, you do women's health. You know about breastfeeding?
Spend a lot of time reading about it.
So you alluded to it in much nicer words than I'm about to, but that's just because I look at the reports and data, and this is how it's used. But the maternal health outcomes in Oklahoma are pretty alarming in a bad way or in a not great way. Do you find that doulas offer benefits to pregnant people and new parents?
Yes, and alarming in a way that Black women and Indigenous women are 2 to 3 times more likely to die in our state than their counterpart white women. So at TBEI, we're starting to dig into all of our data. And one of the things that we have found that our Black birthing mothers experience half the preterm birth rate of the state, as well as have a low infant, it's so many words that all sound the same, birth weight. So we are starting to see a lot of like promising data that backs up what we are doing and are super excited. And if you look into just like national statistics, women who work with doulas are more likely to breastfeed, which we know that there are a lot of great health outcomes on that side as well. So yeah, lots of great things that we're starting to see.
And you're seeing that within the program from
Yes.
people, from clients who have gone through it.
Mm-hmm.
That is amazing. Wow.
Somewhere else we need to connect talking about data.
Yes.
And then, and some of those communities even started to spread out with COVID. So
you mentioned that TBEI is a resource for the Black community and Black women. You've recently expanded and offering services to the Latinx community as well. These are 2 communities with especially high rates of poor maternal health outcomes, as you mentioned, unfortunately, including maternal mortality or maternal death. What is the importance of providing the support to communities of color? You mentioned that specifically, it improves health outcomes. What about the model of community-based doulas that is so important?
So people who are familiar with doulas typically know of a doula as being accessible to people who have means, whether that's middle class or upper class. But a community-based doula model trains people of and from the community, so they come to the table with life experiences that they can share with the person that they're serving. It also helps kindle the relationship. The big thing, so a traditional doula typically only sees their client 3 to 4 times throughout the pregnancy, and it's usually closer to the end of the pregnancy and then, of course, the birth, and can cost upwards of $3,000 plus.
And that's in total?
Mm-hmm.
Oh, goodness.
And that's out of pocket.
Yep, that's, wow.
Most traditional doulas probably until recently did not have a Medicaid population. I think it's safe to say that. Where your community-based doula is more about building the relationship. At TBI, our doulas average about 20 to 30 visits per client.
That's impressive.
Very different. And we recently expanded our services because the other thing with a traditional doula, you're usually cut off of services. You can pay for some extra. There are opportunities to like have overnights and things like that. Again, that's available to those who have means. But we recently, when the state last year expanding postpartum care to a year, we expanded our support to a year as well. So those 30 to, average visits are going to spike once we pull that data down. But also, so the relationship is a huge thing, making sure. And then part of that, like building the relationship, is the number of visits that go into it.
As you've expanded the amount of visits and expanding into that 1 year, Are the doulas at TBEI working more with maybe parent-child relationships than a traditional doula? I'm just kind of wondering what is the offer in that extended time?
Yes, absolutely. So now we've gotten into, because I mean, in maternal health, it's hard to talk about maternal health without also talking about the infant health. And I think a lot of times we try to separate the two, and especially when you're talking about infant mortality. But I mean, as I'm sure you're aware, a lot of the spikes in infant mortality that we've seen across the state were because mother's health was not where it needed to be. So yes, supporting the mom in making sure that she understands we're about to launch of like what I didn't know as a mom. I had a conversation with a family member. Actually, she had her baby and she was like, we went to dinner, or we had dinner, we went to bed, and the baby just kept waking up crying. And I was like, well, wait, did you feed the baby? That's why the baby kept crying. And so a lot of things, like depending on your upbringing, you take for granted that you already knew. But like, yes, the baby has to eat every 2 hours. And so doulas can push in and kind of help, especially new moms, like navigate all of those different things. And it may be in that year's time, because usually it's really intense the first 3 months as they get adjusted. And it may be that a mom tells us that she doesn't need us anymore. But what we do is we continue to just call them at least once a month because circumstances change and, you know, something may have happened and now the world has fallen out and here I am, I'm back here to support you.
So has TBEI expanded its education and training for doulas to also include some of that infant care?
So we actually launched in the last 6 months our CEC program, which we're super excited about. We've been training a lot of women across the community to be doulas, but we're trying to pull them back in and activate them because, of course, TBEI can't hire everybody we train, but we want to support them in their business model, making sure that they stay up to date on the latest and greatest information that's out there. And we're not only doing that for our doulas, but whenever we make it into our new space, we're about to launch Nest U, which we'll be doing it on a client level, bringing clients together to build community as well, and then educating them on different topics that they say that they want more information about. So we're excited to launch that.
I'm just going to say your group are a bunch of just wonderkins because I think I'm going to start keeping like a tally of everything when you're like, oh, we're about to launch. Oh, I think we're at 4. I don't know how you're doing this because I know your
got
team.
A great
it's not
team.
that big.
but it's a lot of awesome women.
Yes. Like I said, I've met most of your team. But geez, that all sounds really,
and we
really
still have
cool.
This whole board of things that we want to do. It's like, wait, we don't have capacity.
Yeah, no, wow, that is really, really impressive and really cool. I remember seeing kind of when TBEI started, that's when I started working at Matriarch. And so it's really awesome to kind of see it really hit its stride and hit past that moment of beginning and now growth. So, wow.
Thank you.
Amazing. On point. I have no words. But moving forward, so as I just established, TBEI and Matriarch, we work really closely, pretty hand in hand on a couple different projects, including the expansion of SoonerCare that you mentioned to 1 year postpartum, which was an amazing feat for all of us. Among other things, doula coverage under SoonerCare was part of those discussions and was also achieved, which is also great. Can you kind of explain how you expect that this will help pregnant people, communities of color, and just Oklahomans?
So definitely huge for Oklahomans and women of color. We know that majority of the people that we service, even though there are no income guidelines, are Medicaid recipients. And so the fact now that we will be able to have another funding source means that we'll be able to bring in more doulas. You know, I talked about it's hard to hire everybody we train, but having another funding source will be great. And then also the other bigger thing, I think, for Oklahomans, which right now TBEI is just in Tulsa, but we have aspirations to take at least our training on the road across Oklahoma. And the reason being is because there's not anyone else doing this doula work across the state. And so when it comes to Oklahoma women and Medicaid being able to cover this, I think we need to equip Oklahoma to be able to provide those services so that women can get this coverage and have healthier birth outcomes.
I'd be really interested to see you all go on tour or expand or however you want to put it into, I think putting it into Oklahoma City, it's not the same, but it'd be like that urban to urban kind of similarity. I'd be really interested to see 5-10 years or maybe less, who knows, trying to go into rural spaces.
Oh, and I'm actually looking at rural first.
Oh, really? That's That's amazing.
I mean, just because there's so many maternal health deserts across our state, it's ridiculous, and thinking about the women in, some communities where there are a large population of immigrants. And what does that look like? They're not getting support in so many different ways. And so bringing in doula care for them, I think will be a game changer.
Yeah, one of the things I've looked at when it comes to those maternal healthcare deserts and birthing center deserts across the state is always like distance. Like that is one of the primary problems is distance.
Mm-hmm.
So I'm eager to see how you overcome that. Because not only would you be based out at Tulsa, or you'd have a satellite like organization, you'd also have to overcome distance.
The same, right? And at the same time, like we have a lot of great ideas that we also want to make sure that we're empowering communities that we are trying to partner with and make them be their own best advocate at the same time. But understanding that like doulas is a answer, it's not the answer. We all have to come together and work. I mean, having a doula in my hometown, remember, doulas don't deliver.
Right.
It just means I have a better support system in my hometown. The distance is still a thing.
Yes, I think you're just going to need to have permanent housing for doulas just right across the street from the hospital, just so they can get there on time. So, talking about expansion and talking about new income sources, you have a brand new government program you're implementing, and those are always seamless. Those go right in. Like nobody even notices and just suddenly it starts working. When it comes to that, what are some of the roadblocks you're seeing? Because as obviously there's a lot of sarcasm there. There is no way you're not having a roadblock. It's just not possible.
Well, one thing I will say, like we are super excited. There have been some hiccups along the way, but I will say that like I have been able to use my voice and become an advocate. And not just for TBEI, I'm thinking about other providers that want to come out, especially because as TBEI, I'm an organization. I have a little bit of like power behind where I'm coming from when working in these spaces. But I also want to be mindful of the one-off individual who comes in and makes sure that they're not navigating. And I will say that the state, those I've worked with have been very welcoming. They reach out to me and like ask, well, we're thinking about doing this. What do you think? Just navigating some of the processes, like I've been trying to do those on my own and not assigning it out to other people on the team. And the reason being is like, I'm writing a list of like, oh, if I'd have known X, Y, and Z when I sat down to do this task, it would have made it so much easier. Cause then I take that back to those working at the state so that they can change the way in which they're doing things to try to make it better. Cause like passing the bill, but nobody has access to it, whether it's a provider or an individual, is senseless, right?
Yes. Yes, it is. And, I remember being in the meetings and the policy was being kind of discussed and formed, and TBEI was very vocal when it came to doula accreditation and being as open with it as possible. And to a lot of credit of that group, including TBEI, Oklahoma has some of the most expansive accreditation acceptance in the country, which is like, wow. It's Oklahoma.
There's a lot of things that are surprising. I mean, even like the rates of reimbursement, like we're in the middle of the road when you look at it and it's like, yeah, okay, yay, Oklahoma did something. So yeah, there are some successes along the way. And the fact, and that just proves one of the things, and like a lot of this predated me, but I know there were conversations because when you're talking about reimbursement for a doctor, a C-section or cesarean section is usually reimbursed at a higher rate. Mm-hmm. However, for a doula, more time is spent when it's a vaginal birth. And so people coming to the table setting reimbursement rates at the same way they do doctors, it just took a conversation to be like, oh yeah, well that makes sense. Because you're not really doing anything in the operating room and it might be like 30 minutes versus a 24-hour birth, right?
Yeah, I totally understand that. Hey, doulas. When you mentioned a kind of like a business consortium, like training people, I think you mentioned a little bit earlier, is that one of the things that you're working with is helping new doulas or doulas set up so they can accept SoonerCare?
Yes. So part of like our certification relaunch and the CECs is we're trying to create community amongst the doulas so they also have a support system amongst themselves, doing little things like we have created a platform called Circle. It's from like Facebook, but it allows us to control the space so that they can do what they want to do in the space and we can share things with them. But also we have been working to try to build a partner because we want to focus on the provider side of it all. but to have another partner that can focus on the business side. So thinking about like, there are a bunch of chambers in town that help with startup businesses. How can we work as that plug and connect them into those things? Because a lot of times it can be daunting. You went through graduation, you completed the class, now what? And it's like you got to get out there and recruit the clients. And a lot of doulas that have gone through are serving clients and not charging anything. At the same time, we want you to be able to put food on your table as well, right? Even when I came into this role and looking at what we were paying our full-time doulas or how they were locked into this box. And it's like, I want them, if this is all I want to do for the rest of my life, I want you to be able to grow and learn and excel in your pay while doing that.
So the doula that I probed for questions, she used the term, I think, paramedical in reference to doulas feeling or operating just outside of the medical system. You don't get much more medical system than Medicaid and SoonerCare.
Mm-hmm.
Like that is the ultimate medical system. Has there been some apprehension for doulas to uptake or even in the future uptake SoonerCare repayment?
Based on especially what I'm hearing from the state. So last I knew, I think there were 4 providers that were registered. So knowing that, and we ourselves, I will also say, we've told doulas that we've trained to like, we're like hand holding them through the process. So that's why I wanted to be involved in doing it also, because when we bring them in and train them, I want to be able to tell them, oh, you don't do that because of this or blah, blah, blah. So just knowing what has been reported to the state, yes, there's been some slowness to it. And I think a lot of doulas are operating on their own. And most providers that are dealing with Medicaid are either in a hospital system or have their individual practice. So they're doing more than just Medicaid reimbursement, to your point earlier. Or
have like a whole billing office.
Yeah. So it can be, for an organization, it's intimidating. So I think a lot of that plays into it. And also, again, working with the state to try to figure out how can we like change this message to make it more friendly so people don't feel. Because the other part of that is while we ended up being a state that is in the middle of the road in comparison to other states when it comes to reimbursement, it's still not enough to cover the time.
Yes, which I think any provider who accepts SoonerCare would also say. You keep using this word, the state, talking to the state. When you went into TBEI or even just as a career path, did you expect to kind of like be an advocate to the state government or to the government as a whole? Because I can just say, I never expected me to end up in this job. So I'm just curious how people end up here.
Well, because of my association with Strong Tomorrows, I was already, and not so much in the same capacity as with TBI, and I keep saying the state because there are different offices that operate. And so like I work with the TANF office in a completely different way than I work with OCA. So I was already kind of navigating some of that stuff with TANF and was hoping that what we were doing with TANF, because knowing that TBI was also a TANF recipient, that we could change the way in which they were thinking about things with TANF and the doula provider care, which we're still working on.
And just for people out there, TANF is a benefit program for families, and then OCA is the people who run SoonerCare. Could have realized around normal people. I'm just like, oh yeah,
all these acronyms.
I speak in abbreviation. So going back to new programs and expansion and stuff, how has the new services for the Latinx community, how has that been going? Has it been difficult to kind of spread the news or even just provide community-based doulas for a new community?
Loaded question, but we were really thoughtful in the way we rolled this out. And just to kind of backtrack, it wasn't until recent COVID numbers came out around maternal care that we actually saw a written disparity within the Latin population. I also serve on the MMRC, the Maternal Mortality Task Force.
Maternal Mortality Review Committee.
Thank you.
Yes, I've had to use that one a lot too.
And so having that experience made me start to question, is it that Latin women really are comparable to white women? I think it's actually the way we collect the data that doesn't tell a true story. So I had been talking to funders for a while about wanting to serve this population. And then, of course, when the data came out, I was like, hey, look, now I have data. But being strategic in partnering with El Centro, right? So this is a community that they work with. And I think we try to do that with all of the populations that we serve. We go to those who are in and of those communities. So it was really thought out. We partnered with El Centro to prepare for the launch of that. I really wanted to launch it 6 months ago, but also like trying to be ready to go into action. So that meant that everything had to be translated, all of our training tools, all of our like teaching tools with clients. So getting all that ready. So when we made the announcement, boom, we could hit the ground running.
You were ready for it. So you keep using, partners. We always use the word partners. It's one of those nonprofit words that don't really have a meaning. Anyone you kind of work with is a partner. Can you give a little elaboration on like how it's been working with clinics and hospitals and people, I guess you could say, in the medical system rather than just outside the medical system?
So TBEI has actually been blessed to have great relationships. We have a hospital quality improvement officer that is amazing, and she's been able to get in and build those relationships. And the interesting thing, I think, that is important for the community to know, I think we put a couple of different hospital systems on a pedestal here, and there is this reputation in the community of other hospital systems. And I mean, OSU and Hillcrest have been some of the best partners that we've had in working through. So we implemented something called Team Birth, which is basically making sure that everybody involved in the care, including the patient, has a voice in the care, and it's not just being done to the patient, which I think is super important. And working with hospital systems that were dedicated to making sure that they play this out, even like having conversations with doctors, like, we were taught this in medical school. Why is this a big deal? We just need to do it. And I'm like, I love the way you talk and think. Like, get everybody else on board. Sometimes, because they are a big system, they can be difficult to navigate, but there are people in places, and we've just been able to plug into those people who have the same passion that we have. And I mean, the other thing is like, it's no secret that the maternity ward is not where hospitals make their money. And even though there are a lot of disparities that happen within those parts of the hospitals, it can be hard sometimes to get people's attention. And so in the hospitals, the 4 hospital systems here in Tulsa, we've been blessed to be able to have some good relationships and get things changed.
I think on behalf of what you said about, labor and delivery, maternity ward, not being the moneymaker. I went recently and I met with a couple rural hospital providers who didn't have labor and delivery because they said it was the most expensive, costly to them. So I think that's, again, coming back to, it's going to be interesting, the trials of trying to expand into a rural area, because even when there is a hospital, there might not be a hospital.
Right.
So, you know what, let's just kind of bring it home, bring it to a close. What is like some great new achievement and milestone you've seen? I think I've counted about 6 times you said implement or new program. I may have miscounted. It might be more. It probably is. But what's the banner thing you want to tell people?
Yeah, I think I've talked about a lot of it. I think right now, like the data that we're seeing that is promising, that's like reinforcing all of the work that we're doing. We also just rolled out a whole new data system, which we're super excited about.
Give it 7.
And I'm excited to see where that's going to take us to be able to tell a better story about the work that we do. And not even just like our successes, right? Also like identifying where we can do better and where we can improve. And like, we're open to seeing those things and talking about them and having conversations, but seeing our doulas. So when I came a little over a year ago, we had 3 full-time doulas. Right now we're on the cusp of having 10 full-time doulas. We have 4 part-time right now, and the goal is to build that to 10 as well. One of the biggest things I think in coming into this role, to your point of what you said earlier on, is like not knowing what a doula is. I still think that there are a lot of communities that now have access that don't know what a doula is. And so working very closely with someone on your team who has been helping us spread the word and educate in communities what it means to have a doula, and especially to know that they have access to a no-cost doula.
Mm-hmm, mm-hmm. Your whole implementing new, and in the end, the banner is, we're just doing the great work we do. We've talked about Tulsa Birth Equity Initiative. We talked about, TBEI, doulas, all of that. Where can people find out more about that stuff or even more about you, apply for a doula, get in contact, click that donate button?
So our website is tulsabei.org, and all of those things are there. I would also encourage you to follow us on our social media pages. We get a lot of DMs and things through Facebook and Instagram as well. Trainings are something that are constantly posted when they're coming up. There's an application process. So if you're interested in going through a doula training, you want to make sure you keep your eye out for those application timelines.
And that's to become a doula.
Uh-huh.
And then someone can also go to the website to ask for a doula.
Yes.
Awesome. Well, Omare, you've been amazing. You're a joy always.
Well, thank you for having me.
Thank you so much. And I hope to, see you around in all your amazing work.
Of course. Thank you.
This has been Policy in Pink, presented by Matriarch, a public health think tank dedicated to Oklahoma women. Join me, Tommy, and a parade of esteemed experts every other week as we discuss the political banter surrounding women's health. Find out more about the topics featured at matriarchok.org. That's matriarch with an E, a fun little play on matriarch and metrics. You can also find us across social media as Matriarch OK. Thank you to our producer, Rant9 and Jesse Ulrich. And once again, my name is Tommy. And remember, all policy is health policy.